Carpal tunnel syndrome, prevent and treat. This exercise consists of 2 parts. Part 2. Meditate in the half-lotus pose like this for a few minutes. Breathe slowly and deeply through the lower abdomen for phases. Inhale, compress, exhale and squeeze the belly. You can pause the video to continue meditating. Come on, let's practice the exercises to treat carpal tunnel syndrome together. Part 2. 6. The 6th technique, twisting and stretching the wrist muscles. Right hand in front, turn hand counterclockwise pointing thumb down. The left hand is similar, but rotate the hand clockwise with the thumb down. Then, press your palms together and interlace your fingers. Pull in by rolling your hands towards your chest, then raise them up very gently. Level 1. Slowly squeeze both hands, gradually increasing the tension to stretch the wrist muscles. Slowly raise your arms upward. Level 2. Slowly extend both forearms forward, then straighten both arms, continuing to increase the tension, pressing the biceps muscles. In this state the wrist muscles are maximally stretched. Do this for several cycles of slow, deep breathing in 4 phases with the lower abdomen. Now we change the position of the hands and do the same. Left hand in front, turn hand clockwise pointing thumb down. The right hand is similar, but rotate the hand counterclockwise with the thumb down. Then, press your palms together and interlace your fingers. Pull in by rolling your hands towards your chest. Then raise them up very gently. Level 1. Slowly squeeze both hands, gradually increasing the tension to stretch the wrist muscles. Slowly raise your arms upward. Level 2. Slowly extend both forearms forward. Then straighten both arms, continuing to increase the tension, pressing the biceps muscles. In this state, the wrist muscles are maximally stretched. Do this for several cycles of slow, deep breathing in 4 phases with the lower abdomen. Seven. The 7th technique. Kneel against the back of the hand, gradually bending both wrists. Let's start with the diamond pose like this. Lift your buttocks up. Then place the backs of your hands on the floor like this. Now keep your arms straight. Place the backs of your hands firmly on the floor. Relax your upper body. And, go. Slowly lower yourself back. Such an outer wrist is more and more flexed. Breathe steadily for several cycles of slow, deep breathing in 4 phases with the lower abdomen. And now we're going to move forward a little. Then move our hands a little further forward to increase the degree of wrist flexion. Continue performing the technique in the same manner as above. Adjust the appropriate distance according to wrist stretch. During several cycles of slow, deep breathing in 4 phases, in the lower abdomen. To exit this posture, move forward. Gently withdraw your arms, then return to the original diamond pose. The 8th technique, kneeling with 2 palms on the ground, gradually bending both wrists. We also followed the same technique as above, only the 2 hands are reversed. Please proceed with me slowly and combine the 4-phase breathing well. We can also adjust the appropriate distance to increase the stretching effect of the wrist. These techniques can be practiced for 3 to 5 cycles of 4-phase abdominal breathing, slow and deep. Now we also come out of this pose similar to the previous technique, Straighten up by removing the arms and return to the original diamond pose. The ninth technique, stretch the vertebrae, stimulate the cervical and brachial plexus. Level 1. Begin with child's pose. Rest your forehead on the ground. Hold and gently press your head to the floor with your hands like this. Use your feet to gently and slowly push forward. In doing so, the head is also slowly rolled on the floor. The vertebrae are stretched, and the cervical plexus and the brachial plexus are stimulated. Breathe steadily, slowly and deeply with your lower abdomen. Relax in child's pose. Level 2. We will perform the familiar yoga pose called plow pose. There are many ways to get into the plow pose. Here we start from the laying of the bridge pose. Although in this position, breathing will be difficult, but always try to breathe as deeply as possible, with your lower abdomen. And 10. Finally, the 10th technique, regulate the spine. Hold your hamstrings with your hands, arch your back and gently roll back and forth like this. Breathe softly, slowly and deeply with your lower abdomen. Now you lay down like this as long as you want. Practice diligently and gradually every day. Wishing you an effective workout, a speedy recovery. Thanks. Goodbye, see you soon.